everybody. As we wait for the next Trump administration, one of the most interesting questions is around a certain RFK Jr., who is the new Secretary of Health Services. I assume he'll be approved by the Senate. Whether he reflects an absurd choice or perhaps something more interesting. One man who looks very carefully at the health industry, a man who I always go to, not for my own health advice, but for advice about the system itself, is Robert Pearl. He's been on the show many times. He used to run Kaiser. He's a much published author. His latest book is ChatGPT, MD. Travels around the world, lecturing, teaches at Stanford. And he's joining us today. Where are you, Robert, today? Yesterday you were in New Zealand. Where are you today?
Today I'm back in California. I taught at Stanford last night, and now I'm down actually in San Diego. So traveling all around, Andrew. And it's a pleasure.
Well, I need to go to your doctor, because however much you travel, you look younger and younger. I don't know what you've done, Robert, but you've done something special. So what do you make of the RFK stuff? I have to admit I find it interesting. I think even if he's a slightly absurd choice, does it speak to something more structural about our healthcare system? You're one of its great critics. You're an insider. You understand all its weaknesses and I guess some of its strengths. What do you make of this appointment?
Well, a couple of things. First of all, I think it's still a little unclear whether he will get ratified. Remember, the Republicans only have 3 votes to spare in the Senate, and 2 of them are likely to go against him. So the possibility is that he will not be.
Why? I mean, aren't there worse appointments, which isn't saying much, but.
Well, he has a very complex history, both as an individual, a long history with addiction, a whole lot of other issues that he's talked about, brain worms, etc. He also has some accusations against him from a sexual nature, and he has some positions that are pretty extreme. So those would be items that would be of consideration at the Senate hearing. But as you mentioned earlier, I don't think it's a question of RFK alone. I think we're seeing a shift in administrative thinking, approaches. It's not about any given individual. I think the tradition has been you appoint experts and you leave them alone to do their job. And I'm very doubtful that that's going to be what we see in the next administration. The next administration has a point of view that differs from the previous ones. And the point of view is that the traditional institutions are broken and change is going to be necessary, and that it's going to be somewhat, I'll call it revolutionary. And I think RFK Jr. fits that mold. And so I think it's more important to think about the broader context and then put him into that context, because he is someone you can't label. I mean, remember, he ran at one point for the president under the Democratic Party. He was considered by former Democratic President Obama to be appointed into that administration. His views can be put in traditional conservative camps and very liberal camps. So I think we have to see him in the complexity of the entire shift in direction that the current administration is contemplating. And we could talk about all the different pieces, everything from nutrition to chronic disease, to vaccination, to coverage and payment inside the Medicare and Medicaid programs, as well as the restrictions or non-restrictions at the state versus federal level. So we have a lot to cover this morning, Andrew, as we look at the future of American healthcare with RFK under the administration of President Trump.
Yeah, it's interesting that I'm not sure if you saw Derek Thompson's piece in The Atlantic. He also sees RFK Jr. as a bellwether. He suggests that he embodies several trends across media, politics, science, and society. Perhaps the central trend is is what Thompson calls an anti-elitist elitist. He seems to be taking advantage of this complete breakdown of trust in professionals, politicians, of course, but also doctors. And this is something that you're all too familiar with.
Very familiar with this. And I try to take a very balanced view. In fact, I'll be publishing a piece in Forbes next week about why I think there's some upsides potentially, because as you know, I'm a big believer that the big challenge we have in our nation today is chronic disease. And we do a terrible job of both preventing and being able to better manage it. And as the CDC has pointed out, that chronic disease, we talk about hypertension, we talk about diabetes, a variety of other conditions, account for 30 to 50% of heart attacks, strokes, kidney failures, and cancers. And if I'm going to try to address the American healthcare system's foibles today, I would start with chronic disease, because that accounts for 70% of the care that Americans receive, as well as at least 70% of the costs that they incur.
But that doesn't get to the issue I brought up about this lack of trust of doctors. I take your point on chronic disease. It's obviously important. Some people listen to their doctors, others don't. But why don't we trust our doctors anymore? It seems as if RFK's obsession with vaccines and water and raw milk and all these other things reflect a fundamental distrust, not just in the medical establishment, but in a broader scientific one.
I think it's less about doctors than institutions. So you take the CDC as an example. I think there's a lot of belief within the Trump administration, and we could be talking about the opinions of RFK Jr., or we could talk about Dr. Oz, or we could talk about Marty McCary. These are individuals who've been very critical and in many cases accurate. And I wrote about some of the challenges that the CDC did. It was very late to have home testing. It relied on laboratory testing, which took multiple days to accomplish and was difficult to achieve. The use of masks in certain situations was indicated, but in schools, it certainly has had a negative impact upon children. And so there's all these different ways that I think the institutions, the CDC, the FDA, the NIH, these are institutions that have been criticized. And I think it's part of this bigger piece that the government is, and the view of the president, bloated and needs to be both stripped down and redesigned. And I think that healthcare is in that same mode in the thinking of the incoming administration. And I think as you pointed out, the appointees are examples of that. And they're selected in many ways because they are individuals who will not simply make incremental change in the current systems, the institutions, the regulatory oversight process, but at least have said in the past they'd like to make revolutionary, radical shifts in each of those. And I think that that's where both the risks and opportunities exist in a next administration. I have a lot of concerns in some areas and some optimism in others.
And I have to admit, when I heard of the RFK appointment, I thought of you because you're an insider. As I said, you ran Kaiser. I think I was a Kaiser member. It's the best insurance I've ever had, a kind of walled garden private insurance system. So you know this system as well as anyone. And you've been very critical. You've been very critical of the profession, of how it works, of the insurance system, of the pharma industry, and most of all of the happiness, or perhaps more appropriately, the unhappiness of doctors and, of course, patients. The system, and please correct me if I'm wrong, Robert, but the system in your mind is broken, isn't it?
Well, as you know, my first book focused on that. It makes no sense to me that we pay on a fee-for-service basis. The more you do, the more you get paid. Whether it's any good doesn't make any difference. In fact, often if you make a mistake, you get paid twice, once to create it, once to try to fix it. It makes no sense to me that we still have individual doctors and hospitals scattered across the community, unconnected with each other and not in groups. It makes no sense to me that we still use the technology from the last century, although the way that clinicians and physicians send vital information, the most common way they communicate information is the fax machine in 1830.
It's astonishing. And jumping in here, Robert, I want to get back on this.
Sure.
But I never get any calls from anyone except spammers and my doctor. They don't know how, they still haven't figured out, or at least the profession hasn't figured out how to use email.
Yep. Or text, or how to use modern information technology systems, or how to use generative AI, or we could have a whole list of ways that what should be a profession at the cutting edge is 20 years in the past.
And the reason for that is because in an odd way, it's a monopoly. They don't care. It makes no difference. No one's competing with them, so they can use, they don't even have to use the phone. They could use messengers on motorbikes. If I needed to tell you something, they could send the messenger that way. There's not much the patient can do.
You're describing the problem very well. It's a very stable institution. At the class I teach at the Stanford Graduate School of Business, we talk about it as ultra stable. And why is something ultra stable? Because the leaders and the players and the incumbents within it do best financially when little changes. And I think what you're seeing, and getting back to the RFK and the entire Trump administration, is this belief that needs to be shattered and broken apart. You're not going to change it by increasing how much you pay doctors by 0.5% or 1% or making a minor shift. We have to have a very different structure. Now, I, in many areas, completely disagree with the change that people are talking about. But the fundamental notion, the fundamental, I think, message of the last administration is that people are unhappy and major change is needed. And if that change breaks things, so be it. And again, I have concerns in that area, but I think that that's the message. And I think that that's the direction. Whether it gets through Congress or not, that's a different question. Whether the realities of trying to address, the area that RFK as Secretary of HHS would have is 25% of the federal government's budget. That's 25% of the largest budget in the world.
I mean, that's astonishing. What is the numbers? It's got to be close to, it's in the hundreds of billions, isn't it?
How about $2 trillion?
$2 trillion budget.
Yeah. I think two or maybe even a little bit.
And Robert, we've talked about this before, but it seems to me maybe the doctors don't entirely benefit. Their lifestyles aren't very attractive, but they make good money. The pharma companies make good money. The insurance companies make good money. Is it ultimately the patient who has to foot literally and metaphorically the bill for this dysfunctional system?
The patient pays a lot. Remember, about half of the U.S. is insured through their employer, in either directly or as a self-funded business. So the businesses of America are funding it. We've been carried, if you look at the past 30 years from an economic perspective, outside of the very narrow period, 2008 to 2010, maybe a little bit in the early 1990s, we've had ever greater wealth in the United States. It's been a good time, actually, from back where we were around 1990. And we've just tolerated it. We've watched costs go up now significantly in almost every year, except during the period of COVID. We saw costs go up more rapidly in healthcare than in the regular GDP. Well, at some point, you can't afford that. And I think we're getting to that point. And right now, again, we're still coasting. Things are going well. But what's going to happen as soon as there's a cutback, as soon as there's a recession, now we're going to see all the pieces fall. So what you're describing as an example is the challenges that exist, the 50% burnout amongst clinicians, the 70% unhappiness amongst patients about the healthcare system. We're seeing the beginning of the end. And at some particular point, again, radical change.
The beginning of the end, maybe that would be the headline of this. The beginning, I mean, RFK may be the beginning of the end of what, 20th century healthcare? How would you describe, what are we talking in terms of this beginning of the end? What is it? The
traditional American healthcare system. That's the end, I think, that sits in play. It's a focus on being a sick care system rather than a healthcare system. I think that again, I'm giving you the optimistic side right now, which is going to be that we have the opportunity now to be able to address chronic disease, to be able to prevent heart attacks and strokes and kidney failures and cancers. And in doing so, we have the opportunity to keep people healthier and lower costs. On the other hand, we may be seeing the end of I'll call it the scientific solution of American healthcare to patient care. As we look at some of the issues around vaccines, and we look at some of the other issues around ways that communicable diseases may not be what we thought they were, or at least what scientists say that they are, and the approaches we take could be setting us back decades and even a century into the past. So there's two different paths that could move forward. One that I think could be positive, but certainly I have major concerns about the other area. I'm a major believer that one of the greatest advances we've made have been vaccines. You know, when writing one of my books about my dad's sister who died from measles. When you cut back on vaccines for measles, I saw a lot of people who got polio. I mean, these are lethal, problematic diseases. I believe that the reason we finally got out of COVID had to do with the fact that we introduced the vaccine that was sitting in place. And some of the people coming into the administration have been critical of those efforts. And right now, you know, bird flu, it seems very minor. It's sitting in cows right now. It just takes a few mutations till it becomes lethal in humans.
Yeah, just a glass of raw milk, probably. Bush Sr., of course, once criticized Reagan economics as voodoo economics. We're talking about, I guess, voodoo science. I do want to come to your advice to RFK if he's watching or interested in hearing what Robert Pearl thinks he should do. But before we get to that, the other problem, Robert, seems to me is price. I mean, I just had I had to have a scan at the hospital. The pricing is so absurd. And you know, when you walk into a store, or you buy a house, or you buy a car, you're given a series of options. With healthcare, no one explains to you how you're being charged or why you're being charged. From a consumer point of view, is that the biggest problem?
Absolutely. The number one problem that consumers say is affordability of healthcare.
But not just I take the affordability, but the fact that it's so mysterious that you have no idea what you're paying for.
I don't know that the mysteriousness is as much an issue. Yes, that's annoying, particularly based upon how much you have to pay out of pocket. But what are you going to do? You're not going to get your heart attack taken care of. You're not going to have your cancer treated.
Right, well, that's the point. And they can, I mean, my point really is maybe not so much the mysteriousness, but the fact that they can charge you anything.
Absolutely. This is the monopolistic control of American medicine that we're seeing. What people have realized, whether it's in the hospital industry or the drug industry, is that the way you do well from a financial perspective as a corporation is to be able to get market control and then basically demand whatever it is you want. There is no, you know, people say, well, explain it to me. There is no explanation for the pricing.
Well, it's the market. You just, if you can,
stupid, that's what it is in American healthcare.
And oddly enough, I think it's, and the other institution that's also in crisis, and I think was going to, in its own way, get swept away in this new administration, is education and universities. And they have the same pricing. They can't explain why my kids' fees at university went from 50 to 75K in a couple of years. No explanation. They just charge it. And all the other colleges charge it. So you don't even have any competition.
You know, I was talking to a friend of mine last night. He needs to have a cataract surgery done. By the way, this is a 15-minute operation, and the bill is going to be $56,000. Now, I can't figure out how you spend $56,000 in 15 minutes when what basically you need is a anesthesiologist, a surgeon, a couple of nurses, and some very basic instruments, and a piece of glass that has to then replace the lens that had been sitting there in place. It just doesn't make any sense. But I think let's move, Andrew, into some of the applications.
Yeah, so I'm not sure if you know RFK, but I'm sure at some point you will talk to people around him, especially if he's if he gets the job. What advice would you give him? Where would you like him to focus?
I'd like him to focus on an area that he's actually been an advocate for, which is chronic disease. Excuse me. If we can't address chronic disease, the epidemic that we face today, and if we can't improve the health and reduce the number of the heart attacks, the strokes, the kidney failure, et cetera, we're never going to be able to provide care that's affordable, that's going to be high quality and achieve good outcomes. And we know what to do. We know how to prevent many of these problems. We know how to treat them when they arise. And as we said earlier, 30 to 50% of these lethal and very expensive problems could be avoided. We need to invest in a combination of dedicated clinicians, a primary care driven model of care, along with a technology, a generative AI tool to both support the clinician and the patient. If we could move from today where we have control that's in the 55, 60% of the time for diabetes, by the way, it's less than 30%. And this is the number one cause of kidney failure and major contributor to heart disease. 30% of Americans have it, and we do a terrible job. How can we address that? And I think that what we need to do is to go back. This is the article that I'll be writing, that we need to recognize that if you look for 2000 to today, we're talking about a mere 20 years, a doubling of chronic disease in the United States, a doubling of diabetes in the United States. Now, think about it, Andrew. What causes a doubling? Is it
mostly associated with eating and obesity?
Exactly. The food industry has recognized that the human brain evolved over tens of thousands of years in times of abundance and scarcity. That was the nature of the world back 10,000, 20,000 years ago. We've learned to gorge ourselves when we find high fat, high caloric foods. Why is that? Because we're going to have a period of starvation that we have to live off of that. Except in the world today, there isn't this period of starvation. And so what they have figured out is by giving foods that are going to be high in fat, high in calories, with a modicum of salt sitting there as well, we can address the taste buds and the human brain frailties. And this is not a new disease. This is an application of scientific approaches to being able to get people to eat more. Goes along with large portions and fast foods. We can lump things together or pull them apart. It doesn't matter. But if we don't change that nutrition, and I use the example, if a child develops a brain encephalopathy, a brain problem from lead, we don't say we have a disease of brain lead disease. We say, no, we have lead in pipes and we have lead in paint and lead in gasoline, and we figure out how to take it out. That, I think, is what is going to be necessary. Now, talk about a medical establishment. The food establishment is probably just as big. And everyone, as you noted earlier, is benefiting financially from it. So making the change won't be easy, which is why, again, I have a little bit of optimism that if it's going to change, it's going to change by radicals coming into this situation and basically saying, look, why shouldn't the companies selling these products have to pay the cost of the medical care? Why shouldn't we figure out how we can make the cost of a food that's going to lead to obesity far more expensive than the cost of a healthy fruit or vegetable?
So it'd be a kind of almost like a carbon tax, a fat tax.
Yeah, we saw that in the soda tax. And if you raise the price of soda enough, you drop the utilization of it. How about if we raise the price of everything that is bad for us through a tax, because someone's going to have to pay in the end. And right now it's being paid by a different person than the person who's benefiting profit-wise. Why don't we transfer that to the person who's responsible, which is going to be the food companies, and get them? I'm not a big believer in prohibitions. I don't think they work, but I am a big believer in economics, and the financial taxing of these harmful products would be an opportunity to shift that. Right now we're focusing on GLP-1 drugs, which, by the way, I'm a big proponent of. I believe they work very well.
These are the diet drugs.
The diet drugs, the weight loss drugs. But the idea of waiting until someone becomes obese and then giving them a medication to reversing it and paying $10,000 a year to accomplish that, it's just foolish. go back and look at the etiology, the cause of it, and try to address it at that particular
Right. I mean, these drugs seem for the pharma industry, it's as if they, so to speak, have their cake and eat it.
Absolutely. Absolutely.
Because everyone relies on these drugs, because once you go off them, then you put even more weight on.
Yeah, you don't lose more. You're going to put more in because you're going to still eat in the old system that sits in place. If you look at childhood obesity, by the way, over the past 50 years, it's gone up by a 5-fold factor. Why is that? Because we're giving kids this food that's going to lead to chronic disease. I mean, it is so obvious. And the solution, I label it foolishness. We have an approach that waits until we have the crisis. You know, it's the old story about all these people who are coming down the river and drowning, and people are putting up nets to catch them, rather than recognizing there's a bridge upstream that is broken and people are just falling into this fast-moving current. We need to go upstream, and upstream, it's very clear where the problem is. The problem is sitting inside of the food industry when it comes to this obesity. So again, getting back to the question of what the Trump administration is going to do within it, or the RFK's application of that, the one piece that to me is positive and optimistic is that RFK has looked at food and the challenge of the industry and the need for proper nutrition. And if someone is going to break this all apart, take on not just a healthcare establishment, but a food establishment, I can't think of someone more likely to do it than RFK, because this is his history of taking on the biggest things and trying to break them. Having said that, I have a lot of concerns.
Yeah, I mean, one of my concerns is that it's such an odd alliance between RFK and Trump. And Trump is exhibit A in how to eat badly, how to rely on fast food. And many of his supporters are people who I think would not be very sympathetic to a large fat, whatever you want to call it, a fat tax or an obesity tax. One of the interesting pieces in The Atlantic was that suggested that RFK is in the wrong agency. He'd be a better agriculture secretary. The stuff you're talking about is a broader problem in America. It's not just healthcare. It's structural. It's associated with farming and particularly big agriculture. What you're talking about is almost like a Manhattan Project for American healthcare and longevity. Can this be done in a 4-year administration?
I don't know that question. You have to ask some of the political experts that are there. But I think that if you look at the mindset, again, Trump has been president in the past, but is not the new president right now. The mindset is that we can move fast, break things fast, make change happen, overnight, 24 hours. You can listen to Trump, you can listen to Musk, you can listen to all the different people that are there. And conceivably, assuming that the courts go along and Congress doesn't overturn it, that could happen. So I think, again, we're in a new era, and people ask me a lot about, what's going to happen. I keep trying to say, don't apply the approaches of what's happened over the past 250 years or whatever in the United States. This is a very different mentality that essentially has executive privilege. It's no longer a balance of 3 parts. Again, in the thinking of the incoming administration, it is one in which the executive branch dominates. And in the domination, sure, we can declare war and do it in 24 hours. We could declare war on food or declare a war on some other parts and theoretically make the change. Now, when you're talking about something as big as 25% of the federal budget, you're talking about something as massive as healthcare or agriculture. I'm not sure, but I think this is the direction that people are going to want to be going in the new administration. To the point you made about the agricultural side, it may be that challenges some of the views that Trump and other people in the administration are going to have. But if you expand that more broadly, I think of this in terms of some of the agencies that exist. You have Medicare and Medicaid. There's going to be major changes around coverage. There's going to be a shift away from a single federal mandate, which is what happened under the Obama administration, under the Affordable Care Act, to a lot of state control. We're going to see a shift in terms of the obligations for coverage in this particular area. We're looking at work requirements as an example in Medicaid. We're going to be looking at what's called short-term insurance policies. No longer will your insurance policy need to cover your expenses should you get sick, but you can buy stripped-down versions that you may find are going to be insufficient. This is a view that says a single one-size-fits-all at the federal level on a coverage issue. And by the way, we're talking about 60 million Americans in Medicare and 80 million in Medicaid. One-size-fits-all can't work, and you're going to have a lot more flexibility.
In terms of insurance, Robert, should people who look after themselves, who don't overeat, who exercise, should they be rewarded in terms of the price of their insurance?
The first step, I believe, is that we need to give them the tools and resources that they need, and we don't provide that today. So I have trouble starting with penalizing the patients. A lot of doctors say that, don't hold me accountable if my patients don't do the things I tell them to do. And I think telling someone, eat better, exercise, doesn't make sense. We need to give them the tools. And it's why I'm such a believer, as you know, my new book, ChatGPT MD, why I'm a believer in generative AI, because I think that has a lot of the tools that patients are going to need to do it. Similarly, I think in terms of managing their chronic diseases when they have it, I think that they need the ability to know how they're doing every day, to be able to monitor themselves. So I think there's a lot of things we need to do first. And then if we do all those things and people don't take advantage of what we give them, I think that conceivably we'd have a financial penalty. But, I teach in the business school and I tell people incentives, financial incentives always work. They just never work the way you expect. You think you're going to get something better, and often what you see is that you get a problem that's worse. I talk about the fact that a medical group that I know decided to give doctors an incentive based on the more colonoscopies they did in a particular day. And so rather than solving a problem when they found one unexpectedly in a diagnostic colonoscopy and taking a polyp out, they rescheduled another visit. Higher cost, greater risk, bigger problems. Financial incentives to me are really the last resort, and we often think of them as the first resort because they seem so simple. Now, I think what we need to do is to figure out, how do we help patients? I don't know anyone who is not in shape, unhealthy, overweight, who wants to be that way. That's what we're seeing with the GLP-1 drugs. Everyone wants these things. We need to
I'm not sure how many people open newspapers these days, but what you got to do is switch on the radio or television or open a newspaper to know that you should exercise and that being overweight is unhealthy. So I'm not sure this is really news to anyone.
Nope, it's not. We just have not had the tools, and I think we have them now. And so again, and I believe that we need to do that. We need to help have lifestyle medicine coaches. We need to have more investment in primary care. So I think these are all opportunities that theoretically, at least, align with the things that both Kennedy and other members who were appointed inside the administration and the healthcare world are going to do.
It's going to be interesting. I mean, maybe the smoking model might be interesting in terms of what we can learn from it. Fewer and fewer people smoke these days. Finally, let's end on the AI stuff. The medical establishment, as we've already discussed, is in great decline when it comes to trust. You've really focused on AI. Your new book, ChatGPT MD, focuses on the need for AI in the medical industry. How should RFK use AI over the next 4 years? Can this be a central plank if he does turn out to be a positive reformer?
The article that I published today on LinkedIn and last week in Forbes talks exactly on this question. 2 parts. We need to augment primary care, and we need to have generative AI. The 2 tools need to come together in synergy. We need to change how we pay primary care physicians in order to be able to reward them when they prevent disease as much as we do it when people intervene. And we need to understand that ChatGPT is going to be the tool to accomplish that. if you have a new diagnosis of hypertension, you see your clinician, he or she prescribes a medication for you and says, I'll see you in 4 months. What happens over those 4 months? No one knows. We have the ability today. My colleagues at the engineering school at Stanford have monitors, little Band-Aid sized pieces that can measure your blood pressure, your pulse, your blood glucose, all the different parameters that we want to measure. It can create let's say, measure your blood pressure 3 times a day. After the end of a month, you have 100 readings. And you say to yourself, 92 are normal, 8 are abnormal. How am I doing? I'm doing great because 92 are normal. No, I'm doing terrible because 8 are abnormal. We don't know. And no clinician wants you to send them 100 readings out of the blood pressure. No, we know after 1 month how you're doing. And how do we change that medication, as you pointed out earlier, not by bringing you to the office, but by doing a text message or an email message or even a phone call, a video visit. It doesn't matter. We could address that and change that trajectory of your blood pressure rather than bring you back in 4 months. And when your blood pressure is elevated 4 months later, what do we say? White coat syndrome. No, we do a poor job. 55 to 60% of the time, we control hypertension, 30% diabetes. We could be over 90%. Now, we have tremendous opportunity, and a generative AI tool is exactly what we need. And I subtitle my book, ChatGPT MD, How AI-Empowered Patients, first patients, and doctors can take back control of American medicine, because now the empowered patient and a dedicated clinician and a generative AI tool can accomplish 10 to 100-fold greater improvements in clinical outcomes than any one of them can do alone. And we're only at the dawn. This technology is doubling in power every year. 5 years from now, it's going to be 32 times more powerful. This will become a central part. And my prediction for the future is that the advances in medicine are going to be led by the patient using technology rather than the clinician.
Wise words, as always, from Robert Pearl. If RFK doesn't get the job because Congress says no, would you take it if you get a call from Trump, Robert?
Only if you do it with me, Andrew.
Yeah, I'll do it as well. We'll do it together. Robert Pearl, as always, a pleasure and an honor. Keep well. If we don't talk before the new year, Happy New Year. We'll talk early in the next year because this stuff isn't going away. It's one of the most interesting stories, I think, in the upcoming Trump administration. So thank you so much, as always, Robert Pearl, author, ChatGPT MD. Thanks.
Thank you, Andrew.
Can I step on the sea?